Hi, welcome back to another episode of In the Field with McKim Creed. My name is Maggie Vance, and I'm the mechanical engineer for this project. Today we are at Atrium Health Cabarrus in Concord, North Carolina, and we are going to be looking at the Behavioral Health Holding Renovation Project. Let's go check it out. We are now in the behavioral health space in the hospital. So we are on the first floor and we are actually located pretty close to the emergency department. So the purpose of this space is to provide a dedicated space for anyone that's coming into the emergency room that may be having behavioral health concerns. They can be moved to this space and treated with dignity and safety while they are being diagnosed. As the MEP engineer on this project, we came to this project at the schematic narrative level. So we wrote a narrative for the general design of the space, and then we took the project through construction documents as well as seeing it through construction administration. This part of the building, it's actually part of the 1997 addition to the hospital. So when you're coming in a space that was already something, you do run into a lot of constraints and issues. We used Revit as our design tool to ensure that all of our new systems were going to mesh with the existing systems, as well as in the constraints of the ceiling height and just kind of the small footprint of the space and the amount of things that had to go in it. This is part of the corridor space, and actually in this area in the hospital, we have no exterior walls. So what you're seeing is actually lights that we have installed to look like exterior windows. All the lighting throughout the space is circadian rhythm lighting to help keep patients in tune with the natural flow of daylight. So in the nurse station, we actually have our thermostat controller. So in each patient space, we have a thermostat sensor plate on the wall, and those are all can be controlled through the nurse station. So if a patient requests that their room is too hot or too cold, the nursing staff can actually come over here and change the temperature in each patient's room. We are in one of the patient rooms. All the devices in the space are anti-ligature. This includes lights as well as ceiling grills and diffusers. We also have anti-ligature sinks and faucets. One thing we really wanted to focus on is making sure that we're putting fixtures in the space that are going to look as much like the rest areas of the hospital as possible. So right now we are standing in the quiet room. So the quiet room is just kind of an alternative space for patients to go if they need to de-escalate a situation, as well as the patient maybe just needs some alone and quiet time away from the rest of the people on this unit. Thank you for tuning in to another episode of In the Field with McKim Creed. We'll see you next time.